Welcome, and thanks a lot to those who already watched our previous sessions of this annual event of the Health for All Film Festival. For newcomers, I remind you that we have a game ongoing through the event today, which is based on a simple question: do you like to tell positive stories? To know more about this game and based on this question, please come back later to watch again the YouTube publication of the event, the opening session. And in this opening session, you will have all the explanation about how to participate in the game through your comments on YouTube. Now it's time for our second award ceremony of this Health for All Film Festival yearly event, with a category dedicated to health emergencies, one of the WHO's major global public health goals, and we obviously received a lot of entries this year in this category, and in others as well, about the COVID-19 pandemic. Some other health emergencies, of course, were covered by the entries, and you will have more explanation again in our opening session about the diversity of entries that we have received. So now it's time to introduce our jurors in this category for health emergencies. For all the jury teams, for all categories, we had external jurors advising the Director General, specifically for this film festival event, and some senior WHO experts are also part of the jury. As external jurors, we have Dr. Leila Hussein from Somalia, psychotherapist and activist on gender rights. Leila, can you hear me? And would you say a few words to introduce yourself?
Hi everyone, I'm Dr. Leila Hussein. I'm a psychotherapist. I'm also the current Global Advocacy Director on Ending FGM. I'm currently based in Kenya, but I'm from the UK. Also a psychotherapist, and I work with women and girls who've experienced sexual abuse, survivors of female genital mutilation, and I've been advocating against that practice for the past 18 years. Thank you for having me.
Thank you, Leila. Thank you. You will have a time to speak more with our winners in a moment. Milica Momcilovic from Serbia is the other external juror in this team, president of the World Federation of Science Journalists. Milica, would you say a couple of words about yourself, please, and your participation here?
Hi all, I'm Milica Momcilovic. I'm currently editor in science program of Radio Television Serbia, also science journalist, and also president of the World Federation of Science Journalists, the unique organization worldwide, which consists of 67 membership associations. So it's more than 10,000 professionals all over the world dedicated to science journalism and communication.
Thank you, Milica. Thanks. And with me here, Dr. Mike Ryan. So we keep a good distance, huh? Team 2 meters, I think we are good. And you are executive director for the Health Emergencies program of the WHO. Would you say also a few words about your participation in this jury?
No, it's been both honoring and humbling to sit with my colleagues to review these videos. They were all superb, and they all made us sit up and think. And we had a desperately difficult time picking the best because they were all the best. We just had to make a decision in the end. So that was the toughest part of this whole process. So thank you all for submitting all of your videos, all of your films, and they certainly moved us as we watched them all. Thank you.
Thanks a lot, Mike. So during this ceremony, we'll give the Grand Prix. We use these French words as I mentioned that in the other ceremonies already. The French touchy word, Grand Prix, for this category on health emergencies. And we also have, you will discover a special mention from the jury. As Mike just said, it was a tough choice for them, and they decided to have another film mentioned to be highlighted today. So let's go for the moment where, Mike, you would give soon the trophy to the winner. The Grand Prix for the category on health emergencies is Stressed, a Pandemic of Fear, a story happening in Jordan, directed by Daniel Wheeler from United Kingdom. Daniel, are you with us?
I am, yeah.
Okay, so first reaction for this Grand Prix that you're receiving today?
Yeah, I still can't quite believe that I've won. Yeah, it hasn't settled in yet. Especially seeing the other fantastic entries in the category, I never expected to win. But thank you so much.
Okay, you're welcome and congratulations. And now it's time for Dr. Mike Ryan to officially give you this present that we have here for you. So Mike, would you like to come closer to his trophy that we have designed for the Health Forum Film Festival? Up to you.
Daniel, on behalf of WHO, I have the pleasure to award you the winner of the 2021 Grand Prix in the category of emergencies. Congratulations to you, congratulations to the whole team that worked with you. But most importantly, congratulations and best wishes to everyone who works with kids, everyone who works with refugees. There are 80 million displaced, forcibly displaced people in the world. Half of them are kids. These children often live without hope. They live without champions. Daniel, you and your team have championed their cause. You've championed their rights. You've championed that their voices be heard. So with that, I congratulate you once more.
Thank you, Mike. And a reaction, Daniel, about this trophy again? A couple of words.
Yeah, firstly, I'd just like to say a huge thank you to everyone at the World Health Organization and the jury. This is a huge honour to win this award, and I'm extremely glad that through platforms like this, more people will see these stories.
So, as you just said, people has to see your film. Some of them maybe in the audience have already watched it on our official selection playlists. But for now, let's watch it again, or watch it for the first time for those who didn't know. And let's play this film, Stressed, a Pandemic of Fear.
So the United Nations says that there's a high prevalence of mental distress worldwide because of the coronavirus pandemic, especially amongst healthcare workers, as you would expect, and children as well.
The United Nations is asking
not
governments
surprising.
that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many.
With all the changes
people.
happening as we overcome
It needs
this
to be front and
pandemic,
center
it's
of our
easy to feel
response.
overwhelmed, anxious, and stressed. So joining us now is board-certified psychiatrist Dr. Jessica.
When you are in a dangerous situation, stress and fear is actually guiding us and helping us to get out of the situation. So it's helpful. However, and there is a big however here, because you can have something called toxic stress. This is when the stress is not longer tolerable and you cannot relax after it. So it becomes more chronic and more permanent. It's all about the starting point. If you are a child living in a refugee camp because you have been living for years in a war that you managed to escape from, you're not ready to deal with COVID. You don't have the capacity, you don't have the energy because of your prior traumas. So this is a huge challenge, making these children very vulnerable in this situation.
أول ما سمعنا إنه في كورونا خفنا كثير، لأنه خايفين إنه يجي حدا من برا يعدينا، يعني خفنا كثير خايفين عليهم إذا حدا انصاب من عائلتي. يعني
شو تتوقعين النهاية هذا المرض؟
نهايته يا ما العيش.
Children are sitting in the camp believing they are going to die. We have to talk with children directly. We have to address COVID-19 directly with them and ask them how they are doing.
يعني نروح أنا وأصحابي المدرسة قبل فيروس كورونا ونلعب وذا، ما نحنش خايفين من فيروس كورونا ذا، وما جا فيروس كورونا يعني احنا خفنا منه غلق منه سريع الانتشار يعني يخبون احنا داخل البيت ما يشتون حاس نخرج بسبب فيروس كورونا ما يشتوش يخسرون احنا.
I would say that my biggest concern in this situation is that it will be very hard to get all children back to school. And if we cannot get these refugees back to school, they will suffer for the rest of their lives.
You just watched the Grand Prix of the Health Emergencies category of the Health for All Film Festival, second edition. I would like our jurors from, external jurors from WHO, Dr. Leila Hussein and Milika Mopsilovic, to react to this, to give their feedback as jurors to this Grand Prix. What would you share with the winner now? Leila, please.
I mean, Daniel, first, I'm so glad I met you in person. Your film impacted me personally as a refugee child. At some point for myself, I became a refugee at the age of 12. Actually, this pandemic triggered a lot of those memories. I haven't been in a refugee camp, so I can't even imagine what that must be like. But as an adult woman, those triggers happened only a year ago, and it really took me back to being that child who did not know what was going to happen. This constant fear, where it becomes toxic, and I'm so glad that the mental health of children have been highlighted in such a way. And I think using visuals like that, you feel you were in there, but for me personally, it was a personal story that I really connected to. So I just want to say thank you for making this film, and I hope the world gets to see this, because I think it's an area, mental health is still a big taboo issue. People don't like talking about refugees, but the mental health of children globally is a massive issue, but specifically children who are refugees. It's a pandemic itself, and it needs to be highlighted. And I'm so happy that you use your skills to really visualize this for all of us. Yeah.
Thank you, Leila. Would you have a question maybe to ask to Daniel, Leila, or you can ask the question later on? It's up to you.
Yeah. I would like to. I want to know how he's felt about making this film, because I can't imagine being on the other side, witnessing. And I know as a therapist myself, when I'm dealing with clients who are extremely traumatized and you really can't do anything, but I know the impact it has on me when I leave that space. So I wondered how you deal with it. How do you take care of yourself afterwards?
Yeah, that's a great question, and I think a lot of filmmakers have to go through that and interview it, and when they're interviewing children that have experienced trauma or this pandemic, for example.
So we'll have Milika giving you also her feedback as a juror, and then you have also Mike, who will give more words to you and on the topic. So Milika, would you share your feelings about this film and how the deliberation happened for you in this team?
Thank you, Daniel, for making this movie. It was really moving to see it, to watch it. And I can only agree with Dr. Ryan and Dr. Leila, what they said, and what we discussed in deliberation of the movies. And it was a tough one, because there are such good movies this year in this category. But I wanted to ask you, as a filmmaker, how did you choose your story?
So for the last few years, I've been covering the Syria crisis. So I've travelled across the region, talking to refugees that have fled Syria, and after a decade of war, the circumstances haven't really changed. So I think when the pandemic started, and I started to see that this stress from the pandemic was reaching everyone and affecting everyone, I thought, well, if it's affecting the rest of us living in completely comfortable kind of conditions, then what effect is it having on these children who have fled, horrific events, through conflict and disaster? What is the effect that it's having on them? And really, as a journalist and as a filmmaker, I really, start off these projects with curiosity. I have a question and I try and answer it. My question at this point was, what was the impact of the pandemic on these incredibly vulnerable children?
Thank you, Daniel.
I just hope that, sorry.
Yeah, go ahead, Milika.
Go on, Gilles. No, I just hope that this movie and the others will find their way to the audience, do some media, even public service broadcasters all over the world. It should be seen. That's my opinion. Thank you, Daniel.
Thanks a lot, Milika. Indeed, in fact, as you know, maybe some of you know, we have invited the public to comment and put questions on the YouTube publications of the 56 short films selected in this film festival. And on your film, I picked up a comment from Victoria Holmes. She said, such a powerful insight into the lesser known impact of the pandemic. Do you believe, and that's maybe a question for Mike Ryan, do you believe that children have had their voices heard during this crisis, and should more films be made that focus on their stories? And I would enlarge the question, maybe, Mike, about vulnerable people in general. Here we have children in displaced children in refugee camps, but if you want to speak about other vulnerable populations being affected by the pandemic, and do we speak about them enough?
Most certainly not. People forcibly displaced, either within their own country or outside their own country, are often the forgotten, the most marginalised people in the world. Within those people, children are the forgotten amongst the forgotten. And those children that have mental health difficulties and happen to be refugees or displaced are the forgotten amongst the forgotten amongst the forgotten. So having films like this that highlight that specific issue is really, really, really important. We have a team embedded with us here at WHO for the whole length of the COVID pandemic, a wonderful team from UNICEF led by Jerome Paffman. And they have really, really highlighted and constantly pushed us in WHO to continue to recognise the differential effects on children. And children, in our view, are not just small adults. The mental and social and health life of kids is not just a direct extrapolation from that of the adult world. They need very special care, they need very special interventions, and they need to be seen and treated in that way and given that special attention that they need. I've worked in emergencies for so many years, and I must say I've seen death and I've seen awful things and worked in Ebola, but it is when you see children in those situations, that is when your heart breaks. That's when your heart truly breaks. So to see this highlighted, and it's not just kids, there are other vulnerable and marginalised, and we've seen in this pandemic, a pandemic of inequity, a pandemic of marginalisation, a pandemic of exclusion, not just a pandemic of a virus. And this pandemic has ripped away the bandages from some very, very old wounds in our society, some very great injustices that are done to people, and particularly to children. So this is a wake-up call for us all, and many of the films in the shortlist addressed various aspects of that. And I think that thing, the one word I think in the film, in Daniel's film, and I think Leila referred to that, the idea of toxic stress, the idea of stress that poisons the spirit and poisons the soul, and to see our children go through that over this pandemic, not only in camps but beyond that, has been very sad and something we need to take very seriously.
I know the WHO response to the pandemic is so wide, there are so many aspects, but on these points, do you have a few examples of some actions that are encouraged by WHO, by the World Health Organization, to face these problems?
Well, we work, first of all, we have to acknowledge our partners the national NGOs, the international non-governmental organisations, our colleagues at the United Nations High Commission for Refugees, in the International Office of Migration, and UNICEF. These are the people who provide primary care, the Red Cross movement. These are our heroes. These really are our heroes. We provide a lot of technical input and standards to them. We work side by side with them. But we've put together a real broad-based response here. So much of our guidance, much of our advice in these situations is generated collectively between the organisations. We work together because these situations, particularly in fragile countries in conflict, it is so hard. People are so far away from care that you cannot deliver that unless you work together. So the one thing I think we are learning, certainly in the UN system, is that we can only serve those most vulnerable when we do our work together, when we strive for excellence, and when we put our differences aside to work in the interest of the people we serve. And I think the pandemic is teaching everyone that we can only work in solidarity, we can only do this together, and nobody should be left behind. And if there's any lesson I want to take from this pandemic, that's the one.
Thank you, Mike. Thank you for this strong statement. And Daniel, would you, now you have heard from the jury team dedicated to this category on health emergencies, does this inspire you, some new ideas or feedback you would like to give as a conclusion before we would move to mentioning the special mention from this jury on another film? Please, Daniel.
Yeah, I'd just like to say thank you so much for your kind words. I'd also like to say a quick thank you to the Norwegian Refugee Council and all the staff that supported the project and the Arctic University of Norway. I'm definitely not finished covering these topics, and this has definitely inspired me to then go out and really look at the other issues caused by the pandemic that are affecting the well-being of children in the Middle East.
Okay, thank you very much, Daniel. So now we are going to move to our second part, let's say, of this award ceremony. This jury team for health emergencies have also, as Dr. Mike Ryan said, had so many good choices to choose from. So they decided to acknowledge another film, a special mention from the jury. And this is a film made in Mongolia, which title is Far Away. And it's directed by Batulga Gandulga. I hope I pronounce your name correctly. Are you with us, Batulga?
Yeah, that's wrong. Thank you.
So, how do you feel about receiving a special mention from this jury team on health emergencies?
It's a pleasure to meet you guys, and thank you to film organizers.
As you know, we are with our jury team, so I'm going to ask Dr. Mike Ryan maybe to comment on this, on your story, the story you told in Mongolia about facing the COVID-19 pandemic in your country. And we are going to also screen your film, of course, for people to watch it. But Mike, maybe a few words before we screen the film?
No, just again to reiterate that the jury had great difficulty in selecting from all the films, but we really felt that Far Away, and Batuga, congratulations on the work, just outstanding from two perspectives. One, I think, in telling a story from the perspective of a people, trying to retain their cultural and ethnic heritage in a difficult circumstance while also facing COVID, and using the strengths of that culture and using the strengths of those links between people to deliver on COVID, that community base, that building from the community's resilience and the community's integrity, and using that as a means to deliver COVID information and COVID care, which is wonderful. The second, I think, and maybe Melika can talk about this, the production values were superb. The imagery, the music, just the way the whole thing was put together, very high production values. So on both fronts, really, really satisfying, really, really satisfying. The only thing I will say is I want to be the doctor in that film. That doctor has the coolest doctor job in the world. So that's the only request I have.
Okay. So maybe you can apply for a job in Mongolia. So let's watch your film, Batulga, before we will discuss with you and with our other jurors, Milika and Leila. So now it's time to watch Far Away, a film directed by Batulga Kadulga.
Эдгээр коронавирустэй ч гэсэн хамгаалах арга хэрэгслүүд байна, тийм ээ? Олон янзын тархалтыг бууруулж чадах болон бидэнд хамтдаа одоо иргэн одоо үйлчлүүлэгч үүдгийг одоо эрүүл мэндийн салбарууд хамтарч юм бол бас болцоо энэ гэдгийг хэлээд байгаа.
Дэлхийн нийтийн COVID-19 цар тахал одоо бүртгэгдэж дэлхийн нийтэд тархснаас хойш Монголд одоо манай Монгол улсад өнгөрсөн жил бол дотоодын халдвар бүртгэж гисэн. Манай аймгийн хувьд бол энэ тохиолдлын удирдлагын тогтолцоог орон нутагт бол хэрэгжүүлэхэд бас тухайн үеийн бас дэлхийн эрүүл мэндийн байгууллагын дэмжлэгээр хэрэгжүүлж ирсэн тухайн журам маань нэлээд суур бол дэмжлэг болсон. Гол юм бүх салбаруудыг оролцуулаад хамтдаа л явж иж хариу харамжаанд төлөвлөгөө өгдөг, хариу харамж авч, хүчин сэргийлэх арга хэмжээ авч. Мянга эрүүл мэндийн ганцаараа үзээд бол ямар ч үр дүнгүй. Аж ахуй нэгж байгууллага цагдаа энэ албадуудаас гадна үйлчлэг үзүүлж байгаа хувийн хвшлийн байгууллагууд иргэд байна. Ийм бүх юмны оролцоотойгоор энэ дээр л одоо тэмцэл. За энэ дээр бид нэр хамгийн гол нь одоо гаднаас халдвар оруулах байна. Тийм учраас бид нар ер нь бүс дээрээс одоо орж ирж байгаа 5 бүс дээр одоо постыг ажиллуулж, пост болгон дээр одоо явуулын төвөгсөн лабораторийг ажиллуулж, орж ирж байгаа хүмүүстээ таналт хийж байгаа. Мөн дотооддоо ороод ирсэн иргэдийн дунд одоо байнгын таналтыг хийж ажиллаж байна.
За ингээд инкот ариун заяа хоёр бол аягүй сайн тандалтанда хамрагдж байгаа. Халуунаа бол өдөр болгон хэлж байгаа. Эрүүл мэндийн байдлаа бол өдөр болгон мэдээлж байгаа. Гэрээ эргэлтээр бол ирэхэд гэртээ бол дэглэм журмаа сайн ингээд мөрдөж байгаа шүү. Ингээд та хоёрт бол баярлалаа.
За Өвсгөл аймаг Дэлхийн эрүүл мэндийн байгууллагын дэмжлэгтэйгээр Сумбаг эмчийг чадваржуулах сургалтыг зохион байгуулсан. За энэ сургалт маань өнөөдөр дэлхийн нийтэд улс оронд үүсэж байгаа COVID-19 цар тахлын үеийн бэлэн байдлаа хангах, ялангуяа салбарынхаа мэрэгчлэтнүүдийг чадваржуулах чиглэсэн энэ сургалт байгаа. За энэ сургалтын хүрээндээ бид нар нэг аймгийн хэмжээнд 140 орчим хүмүүсийг сургаад байна.
За өнөөдөр энэ сумын хувьд бол нийтдээ нэг 2000 гаруй айл өрх байгаа. 5000 гаруй хүн амтаа. За үүний одоо нэг 500 орчим айл өрх нь бол 150-аас дээш километр газар одоо өвлийн үйлрэлд бол отор нүүдэл хийж амьдардаг ийм иргэд.
Монгол улсд бол энэ эрүүл мэндийн салбарын хамгийн одоо өрмөц тогтолцоо бол энэ багийн эмчийн тогтолцоо. Анслагдсан бүс нутагт амьдарч байгаа иргэдийнхаа дунд өөрөө тэнд нь байгаад тэгээ одоо анхан шатны тусламж үйлчилгээг үзүүлж шаардлагатай хүмүүсээ одоо сумынхаа эмчтэй холбож сумдууга одоо тусламжууд илгээдэг ийм одоо үүрэг чиг бүхий ийм сумын одоо багийн эмчнэр байгаа.
Намайг ямаахан тавааж явдаг. Өвсгөл аймгийн цагаан нур сумын 2 дөрвийн эмч нутагтаа ажиллаж байна 32 жил. Одоо манай энэ нутагт бол баруун зүүн тай гэж байна, тайгийн иргэд байна, байг нүүдлэн амьдралыг юм онцлогтой. Энэ хүмүүсээ дагаад бол одоо тэр бол дагаал байг нүүдлэн бас амьдарч байгаа. 2 талын тайг руу бол зундаа бол 90 гаруй километр, өвөлдөө бол нэг 70 гаруй километр явж үйлчлдэг. Сумдаа бол нийт бол хүн амдаа үйлчлэгтэй бол дуудлаганд явна. Одоо 0-5 настай хүүхдтэй вакцинд явна. 0-9 настай хүүхдийн тэгээд 5 настай хүүхдийн хавар намар амин дэм дахлаажуулалтын бүхэн өндөрлөнгөө бүх хилжингээ банк хэмжин өндөр настайгаа хяналттай хийн жирэмсэн эмчүүдийг эрт илрүүлж хяналтанд оруулнаа. Дэлхийн эрүүл мэндийн байгууллага аймгийн эрүүл мэндийн газарт хамтарсан коронавирусын эсрэг яаж шинжилгээ авах уу, өөрийгөө яаж хамгаалах уу тийм сургалтууд явуулсан. Тэр сургалтанд суугаад нэлээд олон цай мэд сурлаа. Одоо манай тай зүүн тагад Улаанбаатар хотоос эрсдэлтэй газар ирсэн хүмүүс байгаа. Тэд дээр очиж би одоо шинжилгээ аван. Тэр хүмүүс бол 14 хоногийн тусгаарлалтанд дууссан. Одоо 14 хоногийн тусгаарлалт дууссан шинжилгээгээ авна. Тэр шинжилгээ авахын би одоо суманд бас шинжилгээний багаж дунд материалаа аваад тэр хүмүүс дээр шинжилгээ авна.
Чи баасан ч бас сарцаагаас сорцоо тэгвэл сарцаагаас савыг хамгаалах хувцас хэрэгслийн одоо бүрэн аваад яваарай. За. Одоо хөдөлгөөн. За та хотоос ирээд 14 жоо маань 15 тонжоо тий. 15 тонжоо маань танаа тэгээд нэг хяналттай хугацаа дуусч байгаа маань 14 хяналттай. Тэгээд 14 хяналттай хугацаа дуусснаас 15 дахь өдрөөс эхлээд танд шинжилгээ авах заяа. Бэрийн шинжилгээ. Айхан байхгүй. За. Таны шинжилгээний хариу сөрөг гарлаа. Нэг зураас сөрөгдөд нэг. Зураас орсон. За. Дэлхийн даяар COVID-19 бид нар одоо ангижраад сайн сагны талаа болоод дуулж хууртаад явъя. Артола жүктөө дайгаларда алала жоккар булутла дүндөө артола жүктөө жоннарос амаллажа хараад үзвэл
ганцхан манай тайгын одоо цаам алж байгаа ард түмэн гэлтгүү тэгэхээр нэг дээрээ одоо их алс хол амьдардаг амьдралынхаа өв соёлыг хамгаалж явж байгаа хүмүүсийн хувьд бол маш хүнд байдаг болов уу гэж миний хувьд бодож байна.
За өнөөдөр манай аймаг бол ногоон бүс ямар ч гэсэн гаднаас бол ковид цар тахлын халдвар бол иргэдийн дунд бүртгэлээгүй байна.
So you just watch the special mention from the Health Emergencies category in the Health for All Film Festival 2021. We have now the jurors who attributed the special mention, Milika Momsilovic and Dr. Leila Hussein. Milika, would you give a feedback to the director of this film?
Congratulations, Batolga. We loved your movie. It was a beautiful one. The cinematography, the editing, the script, everything, the music. And we also, I think, we loved the sense of humor that you brought also to this story and how you showed the community. That's, I think, our impression the most is the beauty of the whole movie.
Thank you, Milika. Would you like to react, Batulga, to say a few words, or and then I will ask Dr. Leila Hussein to also give a feedback to you.
Thank you, everybody. Mongolia is the seventh largest country in Asia, but the population is only 2.3 million. 3.3 million. And 40% of the population lives in the capital city of Ulaanbaatar. Almost another 40%. And COVID-19 is the new challenge for the Mongolians and health workers. Reach out and serve people. It's a really hard work because of our nomadic lifestyle. And I try to show this new challenge.
Thank you, Batulga. Thank you, Dr. Leila Hussein. Would you add a few words to our director of this special mention from the jury?
Yeah, I mean, as my fellow jurors have said, I mean, this film, I know we had quite extensive conversation about it. It's, as Malik said, you know, it's beautifully shot, the music, the scenery, everything. And also, I think, I'm glad the world will see that beautiful side of Mongolia. So I think there's another perception in other parts of the world. So I'm just so glad you showed it. But also what I loved about the film is how that part of the world is dealing with COVID-19 in a calm way. I love the calmness. And there was people very spiritual as they're going to get their testing done. It's something that's so missing from people right now. And I wish, I mean, the lesson for me is, yes, there's a crisis happening, but there's another example how you keep calm and collective, humorous, you know. So for me, it was just, again, another story that needed to be told. And thank you so much and congratulations. I mean, it's a really beautiful, amazing film. And again, I hope many people see this film. Absolutely.
Thank you a lot, Dr. Leila Hussein. Now, I have a question for Mike Ryan. This film shows the training component for the health workers in Mongolia. Did WHO develop some specific advice for training of health workers in the context of a pandemic to such countries like Mongolia?
No, absolutely. And it is so gratifying to see that, because we can write all the guidelines we like in Geneva. We can create all of the training programs we like. But unless they reach frontline health workers, unless there are trainers in country who can translate that into meaningful activity, transfer that capability to people, it doesn't work. And unless those workers have the right tools and the right protection, they can't work. Unless they're paid, they can't work. So it's one piece of a very complex puzzle. Our frontline health workers in the world are underserved, they're under-recognized, very often under-protected, they're often attacked, and we've seen many attacks on healthcare. So this precious resource we have, and remember, 70 to 80% of frontline health workers are women who are taking the leadership in delivery of healthcare in this world today. But they are not properly trained, not properly served, not properly paid, not properly rewarded or regarded. Transferring that knowledge is precious, but it's just one piece. And the film really shows the importance of how health workers, primary healthcare workers, are intertwined with their communities. They're not separate from their communities. They're part of their communities. Our job is to deliver services and knowledge to communities, not to tell communities what to do, not to force communities into actions they don't want to carry out, but to involve and empower communities, train healthcare workers within communities for communities. So healthcare is delivered by communities for people. And I think this film really demonstrates the power of that. And yes, we do our part. We provide some of the training material and we do our part. But the main part in this is delivered by those health workers themselves. They're heroes to me, they're heroes to the world. And COVID-19 has clearly shown just how much we rely on these very special people in our lives.
In your communication, Dr. Ryan, you often mention the big role of communities. And this film festival is really about collecting stories from communities and from the different levels in the communities, whether it's local or national. Would you have a conclusion about encouraging more people to produce stories about what they do in the community level? Would you like this film festival to continue to encourage more people to propose their stories next year, for instance?
Yeah, absolutely. In the culture that I come from, telling stories is everything. I come from a country in which stuff was never written down until a couple of 100 years ago. Everything in our culture is about the stories that are told. I'm speaking of Ireland. Yeah. And that's the same in many indigenous cultures around the world. We tell our stories to each other. That's how we remember and how we don't forget. We learn the lessons as a community, the stories and the legends that guide us for the future. In telling those stories, we also learn new respect for our elders and people who carry that knowledge for the next generation. And children learn to listen to those stories. And I think storytelling is not just about the story. It's about the way in which the story is told. It's about the teller of the story. It's about the people who listen to that story. And that's an engagement. It's not just someone making a film and someone watching a film. It's an engagement between people. And that ultimately, movie making is storytelling. And I hope, and congratulations to you, Gilles, and everyone associated with this festival. This is exactly how WHO should be transforming, in being more relevant, more open, changing our relationship with the world, transforming how we engage the world. And this festival is just one example of how Dr. Tedros is driving us to change our mindset and to engage in the world in a different way.
Thank you, Mike. And maybe, indeed, I would like to have the same conclusion or some kind of conclusion from Dr. Leila Hussein and Milica Momcilovic. Milica, you're the president of the World Federation of Science Journalists. I mean, telling stories for science journalists is maybe a different kind of approach than stories at the community level. But would you have something to complement on the kind of films or stories we would need to listen more with some scientific content, which would also give information required in addition to the emotion coming from the community level?
First, I was amazed how big was the production for 2020, because I know how difficult it is. And also I was in a way surprised of the choice of stories that we have been able to see. And these films are very important. They're testaments of the time that we live in and of this crisis that we are going through. So this is, for me, most important value of those films, of those stories. And I think that we all should support production of more stories like this. And I think that media needs to embrace this features, documentaries, stories, and include them more in their programs worldwide. Because I think we all can agree that we would like to see Far Away, as well as stressed our Grand Prix winner. The very important story that it's not, you can't see it every day, not on television, on traditional media. And for me personally, I need to say that this was one of the most daunting assignments that I have ever undertaken. But it has also been one of the most satisfying. It was an opportunity to watch films that are beautiful, moving, and above all, meaningful. And that's, I thank you for inviting me to the jury.
You're welcome, Milka. Thank you very much for these words. And Dr. Leila Hussein, a last conclusion from you as a juror?
I mean, just following up on what Milika was saying, one, these stories are very important to tell, and I'm glad I was very honoured and privileged to have been in a position where I can actually see about. But I'm wishing for the world, and as Milika said, the mainstream media really needs to pick up on this. We cannot keep showing the same things. We need to tell diverse stories. But also for me, if I just come back to Far Away, it's not your usual stories I get to hear every day, and I hope more films like that are made. And again, congratulations to all the filmmakers, who made these films in such difficult times. I can't even imagine. I presented many documentaries before, and I know the production that it goes into it. So to do this in such difficult times and environment, yeah, it's been amazing to be part of this. Hopefully next year we'll be together physically. That's what I'm hoping for.
Thank you, Leila. And now let's conclude this session on this award ceremony. We are going to have another one coming soon on universal health coverage. And I think you just said the good words for the conclusions. This film festival is really about connecting people from the community level to national, international levels, to have different people on board from the scientific communities, the health workers communities, the patient communities, filmmakers, of course. So it's really about connecting people. So I hope what we are doing now, these ceremonies, are helping also to encourage that. Let's see each other soon for the next award ceremony.
lancha a recorrer 40 días para visitar las comunidades que se encuentran sobre ese río. Estamos hablando de 72.000 kilómetros cuadrados, zona selvática con 80 al 90% de la población es indígena que vive en comunidades que están localizadas en las laderas de los ríos.
El acceso a Iniria es complicado porque aquí solo se ingresa o por río o por aire, no hay carreteras.
Empezó pues por el barrio, casi en la misma semana casi todo el mundo pues del barrio resultó contagiado. Se propagó pues de manera considerable y afectando la situación económica. Hubo pérdidas de familiares también, sufrimos la enfermedad.
Buenos días, hola muñeca, buenos días. ¿Cuántas personas viven acá, mamá?
Muchas veces las poblaciones, si no se les da una explicación cuál es el beneficio, no lo conocen, no lo interpretan, es más difícil que lo acepten. Por lo tanto, el plan de vacunación a nivel territorial debe de tener ese componente de comunicación y así poder contribuir a que las poblaciones las acepten.
Gracias.
Fue algo que no respetó ni raza ni estrato social. Yo diría que por el bienestar de todos debemos hacerlo. Es un compromiso para nosotros, para nuestros hijos también.
Our stories define us. They remind us of who we are and what's possible for our lives. In the empty desert of southern Ethiopia, more than 150,000 men, women, and children live as refugees. Their stories have been interrupted by the horrors of war. Forced by armed conflict to leave their homes in neighboring Somalia, they live suspended between a life they cannot return to and an uncertain future. To a young person in this isolated outpost, the future can feel as empty as the desert.
While they are crossing different areas to reach here in Melkadida refugee campus, they may face so many harsh and, traumatizing events.
So today we're in Dolo Ado refugee camp in Ethiopia, and it's the first day of our 9-day photo camp with National Geographic, working with some of the youth here in this camp.
What's interesting about the photo camps where they partner with International Medical Corps is that there's a very strong mental health component.
Social isolation or social exclusion is a key determining factor of poor mental health, no matter what age we are, but particularly when you're a child. And being in a camp like Dolo Ado can be incredibly isolating.
Kids your age all around the whole world have used this tool to tell their story, and now it's your turn.
The importance to ensuring we have mental health activities on top of basic essentials such as shelter, water, food, etc., is that without good mental health, they're not going to be able to engage even in any service to support them. They're going to potentially end up with a diagnosable mental health disorder, which means that then potentially they're going to need medication as well. So we don't actually want people to deteriorate.
Getting the cameras for the first time, I think it was really exciting for the kids, and I think that the idea that they were trusted with these cameras and this equipment was really gave them a lot of confidence for the rest of the week.
Portrait can be taken close up in the face. Maybe it's midway, or maybe you see the full body of somebody. So in your portraits, think about face, midway, full body.
waxaan ka bartay sidii qalabyaha loo isticmaalo koodin ma ayna garan jirin si waxa loo qaado waan iska fiirsan jiray dadka oo kaamirada oo qaadi jiray ma fahamsaneen inaan saan loo qaadi jirin haddana waxaan kale ka fahmay sidii uu loo qaado kaamiraha meeshuu looga tago waan bartay haye meesha looga soo dhawaayay meesha laga dheeraayay haye sidii oo loo weynayo intaasba waxaasaa fahmay
dhammaantood inta shantan gruubka nahay iyo inta kaleba saaxiib baan la yeeshay inkastoo guryahooda garanay laakiin saaxiib khaasoo guud ahaaneyn waayo waxbaan soo wada baranay kamarad baan lasoo wada baray si fotograafta loo qaado aad baan saaxiib badan ugu yeeshay 20 qofa.
And so I'm sitting in my room and I'm going through the images and I was like, I'm like, oh my gosh, I'm gonna have a lot of work to do because they were so good. Good morning, everyone.
Erica and I will talk about a different kind of picture, not portraits, but what we call details.
I would say it was some of the most intimate moments we got to see, beautifully intimate moments.
And as they all laughingly joked about knowing National Geographic and seeing the TV shows and the wildlife shows, so they have a sense of who this group of photographers are, and being given that level of importance and respect from those sorts of adults is also very aspirational for them, because it may be the first time for some of them that they are really being given a lot of respect and confidence and trust.
أنا صورة مانتا كل ولي ملعن كامل ولي إلى الجري ما ولا الكي وإلى الجري وجبه وهلا بسوقه هذا كامل كرسوني اللي وقع من عيالي سي يقولي بي
درين فرحات وايو aniga oo dad aan dee badan aan la hadli jirin ayaa dantu igu qasabto oo kalsooni baan helaynaa qofkan la hadlo ku dhaw sawir ka qaadan karaa isagoo qofka aali oo galina sawirkan ma qaadan jirin aad baan ugu faraxsanaynaa sawirka.
When you're doing landscapes today, it's really about looking from a distance and showing a very wide view of things.
So day 4, we ended up doing a full day of editing. I asked them to take a look at them. What's important? Which ones do you want? You get to choose 2 because that's how many we could print for the show.
sawir aan soo ku qaaday oo dad kala duwan ay ku jireen ayagoon ay arkeenin ama aniga warqayn oo ay ku jireen naag ama wiil kor taagan dukaanley ah ku jira ayagoon ay arkeenin aan ka qaaday sawirka. sawiradan qaaday sawir ay gabadha dhaxran la dhaho kamarteeda iga qaaday shalay markaan buurta joognay sawirkaas aad ii qalbiyan jeclahay rabaanay in laga soo saaro.
waxaan ugu jeclahay sawirkan ugu jeclahay waxaa waaye sawir aan buurtaan ka soo qaaday wiil saaxiibkay ah aan ka soo qaaday oo si fiican u sawiray oo muuqda xerada waxyaalka iyo waxaas ay muuqdaan kaasaan ugu jeclahay.
When they are together, they are playing, they are talking, they are, you know, they become socialized.
dad aan aqoonin qaxootiga laga soo kala waday ahaayeen kulli xitaa kuma jiro qof aan isku soo nahay saasoo taadana dad badan aan ku kulanay oo bari ka maalin xitaa aan isla shaqeyn karo.
To give an opportunity for a community to come together and have a community celebration and music and laughter and refreshments and dancing, and to be really proud of their children and proud of themselves as parents and caregivers, again is a huge boost to people's positive mental health.
waxaa igu soo kordhay aqoon dheeraada oo aan hore u garanayna oo haddana aan waxaan rabaa qabsan karo guriga maalintii aan baado.
waxaa kala sheekeen lahaa waxaa la sheegay hooyaday taariikh badan oo soo martaa la sheegay.
waxaa waaye qofka ma hor istaagi jirin waxaan ka faa'iiday inaan qofka hor istaagaan dhaho inaan ku sawirtaan rabaa oo qofka karta aan kula hadlan helo.
Life as a refugee can be harsh and uncertain, but our futures are born of our dreams and our imagination. These students have experienced themselves and their world in a new way, giving them an opening to dream new dreams and to imagine a future as wide as the desert and full of possibility.
dareen aad iyo aad wanaagsan waayo aqoon aadan leeyahay marka ay yeeltid aan dareemi karnaa dareenka ay la eg tahay misana aad aqoon dheeraad ay kugu soo siyaado marka qaadaysid jirkaaga farxad aad weyn aad ka dareemaysaa fiimiskaaga.
عادي كتير. فجأة على الساعة 6 بينسمع صوت كأن شيء هو مثل الطيران إذا بدك، فكنا ما في ثواني نسمع صوت انفجار كتير قوي، غبرة بيضاء، ضياعتم، كل شيء عم بيوقع علينا. وقفنا بقوة، رجعنا تذكرنا إنه في عنا أولاد بين إيدينا، بدنا نخلص الأولاد بعدين نرجع بنخلص نفسنا.
Dès notre arrivée, on a reçu beaucoup d'urgences, et parmi ces urgences, il y avait celles post-explosion. Des séquelles, des brûlures, des traumatismes, des douleurs thoraciques post-explosion, mais on a reçu aussi d'autres urgences autres que les explosions.
Really want to open fast so that the children and all the population can have access again to this hospital. And when we arrived, they were completely destroyed. Like electricity was down, oxygen network, ventilation, ceilings, doors, windows, everything was broken.
صدمنا، زعلنا، بكينا، تأثرنا، بس مثل ما بيقولوا رجعنا لملمنا جروحنا وقلنا يلا بدنا نقوم نشتغل وبدنا نرجع نعمر عن جديد بالموجود. الحمد لله يمكن في كتير عم بيساعدونا وقدرنا نقوم وبفترة كتير قليلة.
The word pandemic comes from, two words, pan, demos. Demos means the people and pan means everyone. Pandemos means, in effect, that the pandemic is affecting everybody on the planet. But we can end the pandemic as a tragedy by stopping the deaths, by stopping the hospitalizations, and we have the power to do that. Vaccines give us the power to do that. The problem is, those vaccines are not in the right places and they're not going into the right people. 85% of all the vaccines are going into high-income countries. Half the world's population effectively does not have access to these vaccines. Vaccines are a global good. They're something that we should distribute on the basis of need, on the basis of the benefit that people derive. If we could just move to distributing vaccines in a slightly fairer way, we can stop the deaths. We can stop the tragedy associated with this pandemic. We can do something now. I'd ask all of you out there, think about this. We need to use vaccines in a much fairer and much more equitable way. This is a test of us as a people globally. Are we prepared to protect the most vulnerable and to stop the death?
Welcome, and thanks a lot to those who already watched our previous session of this annual event of the Health for All Film Festival. For newcomers, I remind you that we have a game ongoing through the event today, which is based on a very simple question: do you like to tell positive stories? To know more about this game and how you can play with it, please come back later on this YouTube publication to listen and watch the event of the opening session, during which we explained the principle of this interactive approach with you. This opening session would also be an occasion, if you didn't see it, to listen to Dr. Tedros, the WHO Director General, announcing all winners of our film festival. It's time now for our third awards ceremony of this festival event, of the second edition of the Health for All Film Festival, with a category dedicated to universal health coverage, one of the WHO's major public health goals. And we will also speak about health equity during this ceremony, which is the main issue for the World Health Organization this year, further to a campaign launched on the 7th of April on the occasion of the World Health Day. And you'll see that the winning films in this category are also an occasion to highlight the International Year of Health and Care Workers. This special year in 2021 was decided by our previous World Health Assembly. In the previous few hours, other award ceremonies were dedicated to other categories of our competition. Please look at the full agenda in our festival webpage. The address is showing below in the screen. And many thanks to spread the word about these ceremonies that you will remain online in the coming weeks. Now it's time to, before we go to giving the prizes and this award ceremony, it's time to introduce the jurors that we had in this category on universal health coverage. So I have Vitika Yadav. Could you hear me, Vitika? Are you online?
Yes, I can hear you.
Okay, please introduce yourself. You are a human rights activist from India, isn't it?
Yes. So I work at the intersection of media and public health, and I'm passionate about young people and sexual and reproductive health and rights. That's my area of work, and I work on sexual rights and gender rights. And in that context, you know, being a jury at the for the film festival and looking at universal health coverage was an honor. Thank you so much.
Thank you, Vitika. You will have the occasion to speak with the winners in a few minutes, in some minutes from now. Second juror we had in this category from external advisors to WHO, Martin Jacobson from Denmark, who is an activist for youth empowerment and director of the NGO Turning Tables. Martin, are you with us?
I am, and it's such a pleasure to be here today with all of you. It's been an exciting process. We've been looking forward to this day to be presenting here, and it's super exciting to be able to commemorate all these stories about the WHO and the activists and the health workers all the way around the globe. So for me, as a director of Turning Tables, where we work with youth to empower them and to work with especially mental processing through creative means, this has been a great journey, and we are really excited to be here.
Thank you, Martin, for this introduction. Great. And so just background information for you in our jury team. For every category, we have 2 external jurors, like the 2 you just heard, and we have also some senior WHO experts who are part of this jury team. And for this category, we have 2 directors from WHO, Deborah Kestel, who is going to join me. So we keep the distances, so I don't have my mask, so we stay 2 meters from each other. Deborah Kestel, Director of the Department of Mental Health.
Hello, and it is a pleasure to be involved in this initiative. There have been a lot of interest and video submissions on mental health, so we learn and we enjoy. So thank you.
Thank you. And Bente Mikkelsen, you are Director of the Non-Communicable Diseases Department, is that right? So please, a few words.
That is right, and thank you for inviting me to this journey. We have actually looked into 15 excellent films, and I mean the choice has been super difficult, and I think what means a lot to me is to see how mental health and non-communicable diseases, people living with cancer, diabetes, lung diseases, and also heart diseases really see the importance of being part of universal health coverage. So the lived experience really come through these videos, so thank you.
Thank you, Bente, for this introduction about the festival approach. So as I said, we'll give 2 prizes during this session. The Grand Prix, so we use a French word, Grand Prix, a bit of French touch. Grand Prix for the category of universal health coverage, and the special prize for health equity. At the end of this ceremony, we are going also to discover a special mention from the jury, which was attributed in the UHC category, UHC for universal health coverage. So let's start first with our special prize for health equity. And I welcome our winner. So, Dr. Anna, I try to pronounce your name correctly. Please help me. Are you here?
Anna Mukumbi.
Mukumbi.
Anna Mukumbi.
Thank you very much, Anna Mukumbi. You're a doctor from the World Heart Federation. And the film, The Beat of Change, Rheumatic Heart Disease, a story happening in Mozambique, obtained the special prize for health equity. So it was submitted by your organization, the World Heart Federation, based in Switzerland, but you will say a couple of words about your federation for us to know more about it. And this federation is one of the partners of WHO, so we are very pleased to have an occasion to give a prize to one of our partners. Would you have a few words? This prize was announced by Dr. Tedros earlier in the day. Would you have a reaction to share with us immediately about this prize before Bente Mikkelsen would offer you the trophy?
Thank you very much. It's really a pleasure to be honored by this prize for me and for my colleagues at World Heart Federation. As you know, we have several members, and being a cardiologist from Mozambique, one of the poorest countries in the world, as part of the World Heart Federation, it gives us great pleasure to have been able to be involved in a film that won this prize. The World Heart Federation is striving for equity, so it's very important for us to be selected in this category. Thank you.
Thank you, Dr. Mukumbi. Now it's my pleasure to invite Dr. Bente Mikkelsen to officially offer you this trophy. Please, Bente.
So, Dr. Mukumbi, I wish we were in the same place at the same time. So, on behalf of the World Health Organization, I'm very honored to give you the special prize. Your film on rheumatic heart diseases is super important. As you mentioned, you're from Mozambique, but you know better than all, I think, that this is a very, very serious disease that can be prevented and is especially affecting women and youth, people beyond 25 years of age in low and middle income countries. And I think through the film you have shown how stigma, how daily life, and how the different conditions for Rosa, new mother, just have given birth to her child, is suffering, and the importance of an equitable health system. And I'm very, very happy and very honored to give you the prize.
Thank you. Thank you very much.
Thanks a lot, Bente and Dr. Mukumbi. Now, I think before we speak about your film a little more between our jurors and yourself, we are going to screen this film so that the audience could watch it. So please, let's watch The Beat of Change, Rheumatic Heart Disease in Mozambique.
Nas minhas primeiras semanas depois do parto, comecei a ficar inflamada, comecei a sentir dor no peito, não conseguia carregar bebê, comecei a me sentir mal, comecei a respirar mal, me senti tão mal e deixar minha filha sozinha, sem mãe. Até que não acreditava que ia voltar ao normal.
At the moment, about 30 million people live with rheumatic heart disease in the world. The same number of people living with HIV/AIDS. The only really big difference is that rheumatic heart disease is not supported by a major organization, and 100 times more funding goes into HIV/AIDS than in rheumatic heart disease.
Taking data from surrounding countries, at least 25,000 people a year in Mozambique may be dying. It affects predominantly women. When you get pregnant, you have more symptoms and more clinical signs that you had before.
Já não estou a estudar, já não estou a trabalhar. Parei tudo.
Rheumatic heart disease is caused by a bacteria. This causes a throat infection that we call pharyngitis or tonsillitis. Being in a low-income setting, we usually miss the chance to properly treat the bacterial tonsillitis. Those susceptible develop acute fever. The third sign that you can have is called pancarditis. Everything in the heart is inflamed. Most important of them is the valves, which do not work properly. So they let blood flow inappropriately. And then you can develop the very severe complication, which is infection inside your heart. Really, one needs urgent surgery, something that we are usually not able to do. We failed as a community because this is a preventable disease by an antibiotic that is cheap. So as a community, we have to improve access to penicillin. We have to improve access to open heart surgery in low-income settings. When you have a disease that is not happening in high-income countries, there's something about inequalities, about disparity that we have to continue to fight for.
In 2018, at the World Health Assembly meeting, there was a resolution passed to improve detection of rheumatic heart disease, to improve the care of people living with rheumatic heart disease.
What we have to do is to improve access to family planning, to improve access to information, to make decisions regarding their life. If they are willing to get pregnant, are already pregnant, or are having a baby.
The World Heart Federation has set up an entire program on rheumatic heart disease for women who are diagnosed with rheumatic heart disease, and also improving access to surgery in low to middle income countries for cardiac thoracic surgeons.
Agora que tomo medicamentos, já consigo carregar bebê, já consigo varrer, já consigo nenecar a bebê, já consigo cozinhar. Já não estou mais inflamada, já desinflamei. A minha filha é o meu orgulho e a minha vitória. Quando olho para ela, eu não olho com aquele olhar de que ela que me fez eu descobrir a doença.
For women, we have learned how painful it is for them not to be able to plan their life. So I think that this is taking away some of your rights as a person, your human rights. If we want to eradicate rheumatic heart disease, we have to understand every side of the problem.
Here we are back in this third award ceremony after watching this special prize about health equity film. And we have, as I said, for the special prize on health equity, we had a special shortlist of 10 films beside the universal health coverage category shortlist. And for this special jury, we had Kumanan Razanathan, who is the unit head for health equity in the World Health Organization. Let's listen to reaction from Kumanan.
This is a wonderful film. It's beautifully made and beautifully shot. And it really does show the challenge of health equity. Here we have a disease that is clearly inequitable. Nobody in the world should need to have rheumatic heart disease. It's easily preventable with a cheap intervention. But due to the inequities we have in terms of the access to health services, many people in the world still do have this problem, which greatly affects their lives and even causes death. And I think the film very clearly shows this challenge, but it's also a hopeful film It shows a young woman taking control and through getting treatment, being able to take agency, live the life she wants to lead, be able to raise her daughter. So there is a lot of hope. It shows that health inequity is not an intractable challenge, but there are choices we can make to support people to lead healthier lives and to create a fairer world. So congratulations again to the World Health Federation, and I hope this prize means that many more people see this very well-made film. Thank you.
Thank you very much, Commandant, for this message to our winner. And now I turn to Bente Mikkelsen again. This, and to our winner, of course, this film, as we said, is about a rare disease. I mean, why do we mention that as a health equity issue? I mean, it's a disease which is curable, but still affecting a lot of vulnerable people, especially women. Is that right? Could you comment on this point of the film?
Yes, so it is especially affecting young people under the age of 25 and women, young adults. And what you can see that in many parts of the world, the disease is eradicated. But then we have in the areas of sub-Saharan, many other areas where it's really low-income populations and indigenous population, the disease still exists. And it is preventable, and it is really dependent on equity. It's dependent on access to healthcare, access to penicillin. It's also very important to do that because it's not curable. So we had, as World Health Organization, a resolution on this in 2018, where we really focus on how to support those who are at risk of getting this disease.
Do you have a question to our winner, Bente, about their World Heart Federation? I suppose you work together from time to time, maybe more often than I know. Do you have a question about this disease and their action on this?
So thank you, and it's true, World Heart Federation is one of our main collaborators in non-communicable diseases, both for rheumatic heart disease, but also for diseases in the heart at all. So I think my question would be, why did you choose exactly this year? Is it a specific ask? Is it sort of linked to what is being done in Mozambique? That would be very interesting to know.
We work with rheumatic heart disease at the World Heart Federation at the global level, and has partners with several other institutions and organizations that are fighting to eradicate rheumatic heart disease worldwide. Most of the initial effort was done in Africa through the Pan-African Society of Cardiology, but then it became a global movement that was really supported by the World Heart Federation. And to emphasize the importance of eradicating such a preventable disease, we consider it the most preventable disease of all cardiovascular diseases. We really set not a neglected cardiovascular disease working group at the World Heart Federation, and this is really to show how important it is. Regarding equity, I think that it's even more important. This is a disease that, as you mentioned, is eradicated in developed countries. Unfortunately, developing countries continue to have it has a very high burden, especially Africa, sub-Saharan Africa. But even in these poor countries, such as Mozambique, this disease affects the poorest of the poor. And you really find in the suburbs, in areas where people have very low conditions for life. And as you mentioned, because the health systems are not strong, you have this progression from a preventable sore throat to a disease that affects the heart, and the disease that affects the heart not being treated. Then you have progress to either death or complications that are very difficult to deal with and that require surgery and very complex treatment. So we are really happy to have highlighted this through our film. Thank you.
So thank you very much, and I would like you to send also the warm regards to Rosa. I think, you know, giving a face and a lived experience to this disease is one of the things that really can support, I think, the awareness and also to help us to fight inequity, both with regards to income, but also the gender dimension in this disease. So thank you very much for that.
Thank you,
Thank you.
Betty. Thank you, Dr. Mikambo. And on behalf of the World Health Organization, I wish you all the best for this, with this film for fighting this problem. I wish you, like last year, we had a special prize for a film about neglected tropical diseases, and I was told that after a year, the prize they received from our festival was very helpful for them to create awareness about this disease. So I wish you the same success with this film and creating awareness about this issue, which is very crucial, as we said, for women in poor areas suffering from a lack of equity facing this disease. So I thank you again.
Thank you very much.
A last word, please.
Thank you very much, and thank you for acknowledging Rosa. She is very happy, and she's with us in this ceremony, watching the ceremony.
Great.
Thank you.
So we all say hello to Rosa, and congratulations for sharing your story and your experience in this film. Now we have to move to the Grand Prix for the Universal Health Coverage category, and as announced by Dr. Tedros during the opening session of this event day, we have our winner online, Susana Beatriz Serrano, for the film Phosphorus. Susana Beatriz Serrano is from El Salvador.
Ella es de El Salvador.
So, are you with us, Susana?
Hi, yes, I'm here. You can hear me?
Yes, Susana, nice to hear you from El Salvador. So, Susana, could you please say a few words about this prize you're receiving and also introduce yourself? Who are you? Are you a filmmaker? Are you a student?
Yes, thank you for this opportunity. And this moment, I can't speak English well. For this reason, I talking in Spanish.
With pleasure. We will translate your intervention.
Okay.
Thank you.
Hola, un gusto a todos.
Greetings to everyone. Thank you very much for this opportunity. I'm Susana Serrano. I'm the director and a producer, editor, and a promoter of this film, Phosphorus. And it is a pleasure for me to be with you. I am a student. I'm studying journalism at the El Salvador University. I hope to finish my studies this year, and with Phosphorus,
Mi primera producción, yo no había creado nada.
This is my first production. I haven't done anything before, as a film before. And it is for me a pleasure to see that it has been pre-selected for this festival.
Great, Susana. So you just said it's your first creation, your first production of a film, and really congratulations for that. Now I turn the floor to Deborah Kestel, Director of Mental Health, to offer to you a present. She will speak in Spanish with you, of course.
Claro,
Congratulations.
felicitaciones. Tengo
In the name of the WHO, it is a great pleasure for me to give you this prize of the Film Festival Health for Everyone in the category Better Health and Well-Being.
Habiendo escuchado ahora que es el primer
I just heard that this is your first film production, so I doubly congratulate you because it is an extremely simple message, extremely easy to understand, and still you could provide feelings so that people can understand the situation you're going through. A Latin American woman to another one, I hug you in the distance.
Thanks a lot, Deborah.
Thank you. Thank you very much.
Thanks a lot, Deborah. Thanks, Susana. Before we speak with you and dialogue with our jurors. You know, we have Vitika Yadav and Martin Jacobson, external jurors in this category who are with us, and who certainly has some questions to ask you or some comments on your film. But before we go in this discussion with our jurors, please let's watch this film Phosphorus, created by Susana Beatriz Serrano, Grand Prix for the Universal Health Coverage category. Let's watch the film. This was Phosphorus, the Grand Prix of the Universal Health Coverage category in the second edition of the Health for All Film Festival. Congratulations again, Susana. Now I'm going to organize this discussion between you, Susana, and so Susana Beatriz Serrano, I repeat your name in full, and our jurors. I would like to have first a reaction, feedback from Vitika Yadav from India, who was one of our external jurors advising Dr. Tedros for this category. Vitika Yadav, would you have a comment to share with Susana about your participation in the jury and the choice for this film?
First and foremost, congratulations, Susanna, for such a powerful film and something that was, that had an immediate connection with me as somebody who was watching the film. It felt, it hit at the right place, and I think it was just extremely powerful narrative and something that was told in a very interesting format. And I think it was just amazingly powerful storytelling without any words being used. So congratulations for that. I think that there was great thinking that had gone into the execution of the film. I actually just have a question for you, in terms of what inspired you. Did you have that moment that inspired you to make this film? And I would really like it if you can answer that question, of course.
So please, Susana, did you catch the question, or should we help you in translating that into Spanish?
Okay.
My first inspiration to do this short film was thanks to an initiative that is being conducted in my country, El Salvador, It is an opening up of a film school in my country, which before wasn't the case. This school has a festival in my country in which different people were invited. It was filmed only with a mobile phone. So this was my chance to take part in this festival, making this short film. And the inspiration is that my sister studied medicine and my mom is a health promoter, so she also works in the health system. And we have all seen what's going on with the COVID-19 pandemic. I just wanted to reflect the whole situation.
I have to give the floor, Susanna, if you don't mind. I would like to hear from Martin Jacobson as well about your film as the other external juror to this team. Martin, would you like to share some thoughts or questions with Susanna Serrano, please?
Yeah, hi Susanna, and it's great to be communicating from Denmark to El Salvador directly as well. It shows us that the whole world comes together to press for these very important issues, very important stories to come out there. And I think that's one of the biggest and most important things about this festival is to get the global perspective into it. And actually, I think that your movie was a very, very good example. Vitica mentioned that there was no words used, that it was you could say a global narrative, and that it was something connecting us in a situation where this pandemic has come across all of us, and it has inflicted us in different ways, has torn us apart from each other, but also at the same time, to a certain degree, it brought back this idea about the connectivity on a global scale. And I was thinking, did you have a global perspective in mind when you did this movie, or was it more of a local situation that you were describing? Because I really think you hit it spot on, something that touches something in all of us.
Did you catch the question, Susanna, or should we help you in translating that?
Yes, maybe you could interpret it. Yes, apart from congratulating you, did you have a global or a local vision when you made the film, bearing in mind that the impact is on a global level? You hit the nail on the head. That's what the speaker said.
Como tema, como producción.
Indeed. When I started off this process and I showed a stop motion to make the film with these matches, was in that sense. That is, I wanted it to be understood not only by people from my country, not only by adults, but also children and all over the world, so that everyone knows the sacrifice that frontline healthcare workers are going through with these pandemics.
Okay, thank you. I have a question for you, Martin, and maybe I'll come back to Vitica also as well. Your NGO Turning Table is about empowering the youth with the use of audiovisual language or audiovisual production. So I think in this prize, it looks like we have an example of what you're used to do with your NGO. Is it right or I'm wrong?
Well, you can say that. I mean, we use creative means to empower and give voice to politically, economically, and socially marginalized youth across the world. And here it is the narrative that is at the core, because it has to be a story that is made from the youth, and that the narrative is presented by the youth. And through this, we process stories that can lead to prevent negative coping mechanisms. And I think this is a good example about a young person expressing themselves, also a young person that has some means to do this, and that's what we are all about, providing the means to marginalized youth worldwide. And I think that you hit it spot on by the simplicity of the stop motion, and as I mentioned before, focusing on the solidarity, what brings us together, and also how small we all are and how much we depend upon each other in this pandemic, but also in a number of other issues, nothing less but the global warming, the climate situation, and all this. But it's a strong reminder of what binds us together instead of what separates us, and also about how small means can be used instead of always focusing on the big money.
Thank you, Martin. Thank you. And now, as I said, maybe a precision from you, Vitika. Since you're from India, this film is telling the story of nurses, doctors, health workers in general being affected by the COVID-19 pandemic. It shows how a person caring for others becomes sick, and with a very sad ending. So in India, you have to face a so huge epidemic at the moment, stronger than before. What do you think this film, could it be also inspirational or something that could be used in a country like yours in India?
Yeah, I mean, I think which is why this film hit so hard, because we are currently in a situation where we are seeing this. We are seeing how nurses, doctors, frontline workers are doing everything that they can to save people and to save lives, and we are having a very, very difficult time. I think the most important thing about this film and the story was just how powerfully it made us feel. It connected us to people and to stories which we might otherwise sort of not focus so much on, or otherwise never know. And it literally puts us in the shoes of people who are on the other side. So I think the empathy, understanding, and the connection that came across with this film, which was very, very strong and felt like a lived experience. I think something that, again, has a very, very global feel, because we can see that it resonates with the emotions that each one of us are feeling around the globe.
Thank you, Vitika. And now, thank you very much. I turn to Bente, and Deborah, you will end this on the health topics, because this film, we have this International Year for Health and Care Workers, which was decided by the World Health Assembly. This film is really about that, a kind of tribute to health workers. So in terms of UHC dimension and this aspect, would you have some comments to add?
Yes, thank you. First of all, I think it's a very, very important film, because it really
shows the sacrifices and the importance of health and care workers. And I think you mentioned India, Gilles, but COVID has been like an X-ray, and it has really shown the fragility of our healthcare system. So many people have not had access to hospitals at all, and not even for the usual diseases like cancer, diabetes, lung diseases, cardiovascular diseases, and mental health as well. So we have a real wake-up call that we need to strengthen the system. And part of the system, I would say the core part of the system, is actually the healthcare workers. So I think this film is a really timely film that can remind us on the importance of a well-functioning healthcare system. And you were asking me to link this to UHC. So universal health coverage means that we have equal access to quality healthcare systems. And if we don't have, we know what will happen. And that is to drive us into poverty. We have too many places in the world where people have to pay out of their own economy, out of their own pockets, to get the essential medicines and care. And that has to be changed. And that has to be changed to be prepared both for the normal life, but of course also for any new pandemic. So I think it's extremely important. So heartfelt congratulations also from me.
Thank you. Thanks a lot, Bente. Deborah, you're a specialist of mental health. This burden on healthcare workers due to the pandemic is also about their mental health, and how health workers they have to be safe if they want the patient to be safe as well.
Yes, indeed. Thank you, Jill. We are aware, and we have been witnessing the impact on mental health of health workers. And the workload, the stress, the tough decisions, the loneliness, the need of time or lack of contact in some cases with family, with loved ones. I mean, all that adds to impacting in a way their mental health. And so we while watching this video, we were thinking about, yes, the impact is there, but there are things that can be done and should be done. And now, over a year after the pandemic began, we should be smarter in a way, or we should be more alert of what could be done in order to protect the mental health of the health workforce. And there are relatively simple issues to do by each one of us taking care of our own mental health, investing in taking care of mental health, the health workers themselves, but also managers or colleagues, peers, paying attention to making sure that there are some breaks in between shifts, that there is a possibility to talk about those tough decisions that they need to encounter, to take every time, that there is some kind of matching peers in a way that the less experienced one works with the more experienced one, that there are routing shifts more stressful with some that are less stressful. So there are a number of actions that should be put in place and should help taking care of the mental health of the health workforce. Again, managers have also responsibility here, and there is a number of material tools available to ensure that some basic training is also delivered in terms of that, precisely how to take care of your own mental health and how to protect and take care of the mental health of those around you, peers, or also the patients you are taking care every day.
Thank you, Deborah. So, Susanna, I don't know if you had all that in mind when you created your film, but at least this is the kind of thoughts that are coming from your film. So would you have a last word to share with us as a conclusion? And then after that, we are going to move to a quick introduction of another prize, which is a special mention from the jury. So please, Susanna, what would be your conclusion after listening to this discussion?
Bueno, la verdad, súper feliz. Creo que
I'm extremely happy. I still find it difficult to believe that my short film has won. I am extremely motivated to go in with this type of activities. As I said, this was my first production, and I will continue to tell stories. Films are the way by which we can tell our daily problems so that we can see around us, and we can also create more awareness. And this is the aim of my film, apart from taking part in this festival. Indeed, that was the idea. People who watch the film need to see how big a problem it is for healthcare workers to have mental health disorders, so that we can show more empathy and understand people working in hospitals during the pandemic. Thank you very much. Muchísimas gracias.
Thank you so much for this. And this, I think it's complicated because I can't speak English well, but in the future I will speak good, no? But the most important to this, to the communicator, to the language, is to talk with your...
Don't worry for that. That's okay. Thank you very much for sharing your experience, and congratulations again, Susanna, for this Grand Prix that you received today. We'll be in touch soon for organizing all of that. Now, we have to speak about this jury team was very touched by another film, and they wanted to give a special mention to this film. The title is Shipatala Shapa Phoni. It's a film telling the story in Malawi of health services by telephone. I make it short. And the film presents this project in Malawi, phone-based health services delivery center, which has increased the access to healthcare. And this is very much about universal health coverage as well, since this UHC program or project and long-term objective is about giving access to quality care to all. So I would like the jury maybe to give a few words on this Shipatala Shapafoni. My African accent may be not good enough.
I think this video really showed the transformative power of telemedicine. And this is very interesting because we have seen that countries during COVID have searched for new solutions, and one of them has been telemedicine. And this is really very much linked to universal health coverage. But and I think Taurai really showed us by telling her story on how they mitigated a very difficult problem by having lack of access to healthcare by using telemedicine. So I think this was so excellent. I wish it was many more Grand Prix, but really we would like as a jury to special mention this film. So thank you.
Thank you. And maybe I ask also our two other jurors, Vitika Yadav and Martin Jacobson. Martin, would you start to give a few words about this special mention?
I think most of the jury was very impressed with this film, and especially its direct applicability on showing the importance of this. I think it was in a different artistic sphere than the winner from our jury, which also was the reason that it won, because it was head and shoulders above every other movie in terms of being artistic and from a communication product. But as an informative video about an important problem, I think that this movie was definitely worth mentioning.
Vitika, do you have a few words as well about this special mention?
Sure. I think last mile accessibility and delivery is extremely important in context of universal health coverage. And when we talk about that, the power of technology and how technology and mobile phones can be used in important ways to get to people, to give them access to information and services is very, very important, and also sort of is the pathway to what we can call, more and more people having access to information and services. So I think in that context, I think the film deserved a special mention, and congratulations for the important work that is being done.
Thank you. Thanks a lot, Vitika. So this is time now for me to thank everybody. Thank you, Bente, Deborah, Susanna, Vitika, and Martin for having had this conversation with us. And we are going to watch this special mention now, because we spoke about it, so you need to see it again if you have not seen it yet. And after this screening of this film, we are going to have a conclusion with my colleague Lorena of this special day, special event of the second edition of the Health for All Film Festival. But first, let's watch this special mention about universal health coverage attributed by the jury.
My name is Taurai Gamfosi. I'm from Zomba district. When I was a child, my father passed away, so I was staying with my mom as a single parent. When you're coming from a poor family, as young women, we face a lot of problems. Men come telling you to do a sexual relationship with them so that they should be giving you money to help your family. That's a big challenge, because only a few girls can say no to that, but others, they end up getting pregnancies and contracting of sexually transmitted infections. The closest health center, when you get there, you join the queue, waiting for so long. And when you get inside For young people like me, we don't like going to the health centers because we feel embarrassed and you don't have enough time to talk to the healthy worker because there are so many people waiting outside, so it's very difficult.
The priority areas for the Ministry of Health at the moment, ensuring that everybody is able to access to health services that Malawi needs. Somebody may be able to get to the health facility, but still not accessing the health care because there are not enough health workers there. Maybe a health center is having maybe 1 or 2 people to serve a catchment area of more than 50,000 people. CCPF Chipata Chapafoni is basically a health center by phone. Increasing access to health services to the people just on their fingertips because they are given health information, providing them a forum where they can express themselves, they talk to somebody who they are not seeing, so they feel free to talk about any issue and also get health information and empower them to participate in their health.
I was really happy to hear about Chipata Chapa phone. Instead of going to the hospital, you just call 54747. You don't have to put airtime. You ask them anything, they will help you. Yeah.
Chipata Chapa phone is helping the government of Malawi to empower mothers to take care of their health and their families and get the right advice accordingly because the information that is being provided to them is information that has been verified, has been packaged properly according to the guidelines in the Ministry of Health.
Ine chipatala chapafoni chinandithandiza chifukwa chona kuti ndine yoyembekezera mimba ya mwana wanga osirizayi. Mimba mandivuta kwambiri neti nkakhala kudabwa kuti sono mimba mundivuta chonchi chifukwa chani. Ndidayimba anandiuza kuti apita mpite kuchipatala akakuthandizeni. Ndinaona kuti zinandichitira bwino kwambiri faina kuti ndimangozikhalira sibwezi ndikuziwa kuti zibwanyi bwezi ndikungovutikabe kumangodwala kumapopo anandithandiza. Nene ndakhala kupereka uphungu umenewu chifukwa chona kuti ineyo zinandichitira bwino ndinawuzaponso anzanga ndipo ndilamulo lake lona kuti amene aliwo pa chipatala chapafoni yenda m'muzi mapeza amayembekezera aja ndimathandiza kuti chipatala chapafoni chilipo mukhoza kugwiritsa ntchito mwaulere chiwagomera kuti ngati anathandizidwa kuchokera pamene pande kuti ndizabwino kuti nanenso mwina kundipeza nkosavula kupeza kuti Gloria volunteer wankulu.
I want to see CCPF reaching out to as many youths as possible because I was facing, a lot of problems as a teenager, and CCPF, it was my opportunity. I discovered that I have a golden voice, so I started composing, writing and recording my own songs, encouraging the youths, especially girls. When I go to the secondary schools, they were like, wow, they were so happy about CCPF through my music. So coming from a poor family is not the end of life. You can still achieve your goals. You can be whatever you want. All you need is just to focus. This song I would like to sing is about a girl who is refusing to go into marriage because she thinks it's early for her to go into marriage. So, there are some parents, they tell their daughters to get married so that they can be helped. She's refusing, saying, leave me alone, I want to learn. It goes like this.
The Japafoni is being taken over by government now because it has proved to be a very, very important tool to deliver health services. We all need to be advocates so that everybody has got the information about Chipatayapa Fund. It provides a lot of potential for Malawi to achieve universal health coverage, because everybody has got access to Chipatayapa Fund as long as they've got the phone, and it's for free.
Chipatala chomwe tinacho pafupi ndikuitanda health center kuti tiyende tikafike umene ndi ulendo wa 6 kilometers. Chimakhala uli nacho pakhomo nsamakuza zochita pakali pano muzikonzekera mwezi wakuti kuchipatala mukayandikire kuchipatala. Ndiyeno tikuyenera tonse tithandizane tigwirane manja pogwiritsa ntchito chipatala chapafoni kuti tichepetse imfa za amayi oyembekezera komanso imfa za ana kuti Malawi wathu akhale wabwino.
History is made by our achievements. We have come a long way to make the impossible possible. When we come together, lives are changed. Our next historic achievement is right in front of us. Health for all humankind. What if everyone had access to the health services they need and were not pushed into poverty paying for it? Together, we can make health for all happen in our lifetime. It's time to make history again.
Abu Musa alikuntuma neno
Wanume drone.
Wopa neno numo
drone. Na wachumire na chesa yaba.
We have now gone through our 3 award ceremonies and a special panel discussion dedicated to health promotion for the youth through filmmaking and arts in general. We really hope that in the WHO that you have been inspired by this program and by our overall Health for All Film Festival adventure. As mentioned in the opening session and reminded several times during the day, we hope to read soon in the YouTube comments of this online streaming your positive stories about health. Lorena, would you please remind the audience how to participate in this game? It's not a competition, but more for an interaction, interactive brainstorming about storytelling. So remind us how to play the game.
Sure, Jill. So it's quite simple for all the audience watching us. You just need to write your story under the comment sections on YouTube from our Health for All Film Festival event. This comment section will be open for several weeks, so you have time to think about this positive story. And then you can write to us in this section, and what we will do after this is to pick some of them and we will highlight them in our website. And it will work as a source of inspiration for our next edition for some filmmakers. We just want your imaginations to be part of our festival. Thank you so much.
Thank you, Lorena. Thanks a lot. And now I propose that we would end our Health for All Film Festival event by listening again to what Dr. Mike Ryan said at the end of the second award ceremony, which was dedicated to our Health Emergencies category. With the hope that we'll continue to receive numerous great short films in our next edition of this film festival. Many thanks to all for your attention and participation so far, wishing you to take care of yourself and your close ones in these difficult times. Let's listen to Mike.
In the culture that I come from, telling stories is everything. I come from a country in which stuff was never written down until a couple of 100 years ago. Everything in our culture is about the stories that are told.
Speaking of Ireland.
I'm speaking of Ireland.
Yeah.
And that's the same in many indigenous cultures around the world. We tell our stories to each other. That's how we remember and how we don't forget. We learn the lessons as a community, the stories and the legends that guide us for the future. In telling those stories, we also learn new respect for our elders and people who carry that knowledge for the next generation. And children learn to listen to those stories. And I think storytelling is not just about the story. It's about the way in which the story is told. It's about the teller of the story. It's about the people who listen to that story. And that's an engagement. It's not just someone making a film and someone watching a film. It's an engagement between people. And that ultimately, movie making is storytelling. And I hope, and congratulations to you, Gilles, and everyone associated with this festival. This is exactly how WHO should be transforming, in being more relevant, more open, changing our relationship with the world, transforming how we engage the world. And this festival is just one example of how Dr. Tedros is driving us to change our mindset and to engage in the world in a different way.